This video here will show you how to train the deep core muscles, the transverse abdominis, and the multifidus. So the first thing is we'll work on the transverse abdominis. Whenever you do a deep core muscle training, the first thing is that you must be in the neutral position. When you're not in a neutral position, it's so easy to compensate with other musculature, right? So sometimes you might have to put a pillow underneath the knee, sometimes you do not, okay? And then sometimes you have to find a position to do it. And sometimes some people prefer supine, sideline, prone. It all depends where you could get the muscles to be the most relaxed and find neutral the most easiest. So I'm going to do in supine, right? And then the third thing is that it is very difficult to train the deep muscles if the superficial muscles are turned on. So you might have to release those muscles first using precision release technique before you do the deep muscle assessment. Go always constantly turn on. So let's pretend that she found neutral here, no problem. Number two, this position here is the one that I found during my assessment where she doesn't activate other muscles the most. And number three, I took care of all the superficial muscles that have been turning on too much. So now, the transverse abdominis, when you're doing the training, the training kind of depends on what the problem that you found, right? So, one problem we found during the transverse abdominis that other muscles are kicking in too much. So, for example, during assessment, you pull your stomach in. Well, suppose I found that these muscles clenching or the oblique muscles clenching too much. I would tell the person, very simple, first cue is do the same contraction but do it 50% less, okay? And explain to them how that all you need is like 10-20% of maximal voluntary isometric contraction for the muscle to work functionally. So it doesn't have to be type of thing. So have the person do that again, and then most of the time the person does it better without the constant compensation. Okay. If that doesn't work, you might have to release those muscles more, release the muscles in the butt muscles in order to get them to activate the deep muscles. Right? Now, the other problem you might get sometimes is that the transverse doesn't kick in at all, right? It doesn't initiate, okay? So some people have no idea what you're talking about. So once again, you might have to change different positions like sideline or prone or quadruped. So when actually pull your stomach in, okay? Sometimes you might use different cues, right? Another cue is that, similar to the multifidus, imagine there's a line from your ASIs to your other ASIs, and you pull your ASIs in. And you think about it, that's the job of the transverse abdominis, and see if that kicks in, right? If that doesn't kick in, you could try the traditional one to pull your stomach in, okay? Once again, you might get other muscles, but it's better than getting nothing to turn on. So that's another approach. So changing position is often helpful. So sometimes you do as well as you could do the opposite. So meaning, I'll put your hand on your pubic bone again, and I tell the person, push up, 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 and then do the opposite, come all the way down, all the way down, all the way down. So sometimes it's easier to teach somebody the extreme opposite to show them what the contrast is. So that was a good way to get the transverse abdominis to kick in as well. Okay. So your goal is to make sure they can kick the muscle on, they're not compensating with other muscles, and can they hold it 10 times for 10 seconds. Once you're able to do this successfully, and the multifidus, we teach them how to turn on both those muscles together, called chord cue, and then we bring in the global muscles depending what their function limitation is during the assessment. But before we do that, we have to discuss multifidus retraining. So keep lying side, face this way. So the way you wake it up, right? So once again, make sure you find the right position, sideline, prone, whatever you feel that she'll compensate the least. And then you have to make sure you're not compensating. So some people will compensate by moving it back a lot, twisting, tightening up the butt muscles, right? If they do that, once again, give them the cue of 50% less. So I'm palpating the multifidus, and as I keep turning on this multifidus, and let's say she's like moving too much, right? Once again, 50% less. Still doing it, I would reduce the muscles. Okay? Now the other scenario is that suppose the muscle doesn't turn on at all. So you could turn on the transverse abdominis because you get a cold contraction of the whole abdominal cavity. You You do a co-contraction of the transverse abdominis with the pelvic floor, and sometimes that gets it going over here. If that doesn't work, sometimes I like to use an overflow technique where I will actually try to pull the person into flexion, and then she has to resist by using her extenders, right? And then we get the multifidus to turn on, okay? The problem, of course, is that you get the superficial muscles, okay? And the person that has a lot of superficial muscle tightness and causing them pain, you might irritate them. So you have to kind of decrease that right away. So this whole goal through this technique is just to get it on and quickly teach them how to do the same thing, but do it with 50% less. So what I mean is, so don't let me move you into flexion. Hold it, hold it, hold it, hold it, hold it, hold it. And then she's doing a nice job of firing it. So you're doing a good job. Let's do the exact same thing again, but 50% less force. I'm pushing you less. And very good. And now you get a nice contraction. Okay? So in order for her to do this, she's actually doing what? Some lumbar extension. Very, very, very small. Very small. You can do lumbar extension by doing this way, or you can do lumbar extension by doing anterior pelvic tilt. Do the same thing. And this is quite helpful, especially if the person has a contracted sacrum. You can teach them to do an anterior pelvic tilt, which nutates the sacrum and gives them a sense of stability that way. Now the other method, right, is similar to the testing method. One finger at the segment, one finger on the ASIS, and pretend you're pulling the two together. If they have no idea how to turn on, I like to put them there. So what I'm doing, I'm approximating. I'm not doing a PNF pattern of posterior elevation. I am approximating. So I approximate and I tell her to hold it here, don't let go. Hold it here, hold it here, hold it here. And then I do an isometric hold. So hold it, hold it, hold it. Don't let me move you. You get a nice contraction. And then I tell her slowly let go, slowly let go. And then approximate again, okay? And that should look familiar to you because that's a combination of isotonics, the PNF principle, right? Because you're doing what? Isometrics, eccentrics, followed by concentric. Okay? Now, if it's for the multifidus of the SI, remember we're trying to bring PSIS to PSIS, right? So a lot of times people have no idea what you're talking about. So you do the job for them. You approximate. So you see this here, hold it here, hold it here, hold it here, and similar to the SI test, you're trying to distract, right, the SI by pushing the iliac. So don't let me move your iliac. Don't let me move the pelvis. And she has to fire that multifidus to kick in. Okay? So those are nice ways of turning on the muscle. Okay. So we talk about downgrading the muscle. We're talking about how to upgrade the deep muscle and downgrading the superficial muscle. And then once they get this, we teach them how to do both at the same time. We call that the cord cue, as per Diane Lee. So essentially you have to turn on the core. So pull your stomach in and turn the back muscle. Whatever cue that you found to be successful, turn both on the same time. Okay? And then turn on both at the same time. Okay? Once you do both at the same time, then you combine it doing global muscle retraining. And that will depend what the functional limitation was. So lie down on your back for this. So if the person has pain with trunk flexion because they have poor control of trunk flexion, we need to do an exercise that challenges trunk flexion and works the extenders. So I will have the person do the cord cue again. So pull the stomach in, activate the multifidus, and maintain that pelvic neutral as you flex your hip. Flex your hip, 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 right? And then you should get around 110 degrees before you compensate at the lumbar spine. So by her doing this, she's working her global muscles, the rectus spine muscles, and the deep core muscles, or the transverse and multifidus, all together. Okay, this is difficult to do from the beginning because a lot of times people will just use the global muscles, not the deep muscles. So once again, it depends on what plane you found the dysfunction. Well, suppose she had more pain with twisting, right? So she did the cord cue again, turn on this one, turn on the back, keep it here, don't move the pelvis, and you could do your bent knee fold out, and then you work on transverse plane control. Okay. Can you lie on your side, face me? Okay. If you want to work on frontal plane control, same thing. Turn on your cord cue, and I want you to abduct your hip without hiking your hip, right? Because that's working your global core muscles. Although lie on your stomach, right? And we do the same thing to work on excessive extension. turn on your multifidus, turn on your transverse abdominis using your core cue, and then lift your leg up here and prevent an extension motion. She's a tough time doing that. Right? So you use your global muscle activation. It all depends, of course, if you're going for motor control or for stabilization, and then you progress accordingly. But no matter what, all your progressions should lead to the functional task or the meaningful task that they're complaining with. So if they have pain with walking or pain with sitting, pain with running, ultimately you're doing these core exercises during that functional task. So can you sit up here, please? Okay. And we'll suppose, as if you have pain with sitting, our teacher activate the core muscles, alright? The good posture, we'll talk about this Rackham principle later, and then activate the muscles as she does proximal hold with distal movement. This will mimic using a mouse. Okay? So it all depends. We'll talk more about this in the next video when we talk about Rackham.